Good afternoon. Welcome back to Facebook Live here in Oneida, Wisconsin on the Oneida Nation Reservation. It's Monday, April 27th. We're glad you're back to join us. This morning we have with us Debbie Danforth from the Oneida Clinic, who will give us our weekly clinical update. We also have Chairman Tehassi Hill, who's going to give us an update on some of the things that the government's been engaged with. We also have with us Kaylynn Gresham, who's our Emergency Management Director. We want the questions to pertain to the guests that we have here today. We know there's a lot of other questions out there, but today we went quite a bit longer on our last session and we missed some of the questions, so we'd like you to keep your questions germane to our guests that are here today. So without any further ado, we'll ask Debbie Danforth to give us our health update.
Thank you, Bobby. Good afternoon. I just want to give you some quick numbers updates so you kind of get a picture in terms of how we are being impacted by the COVID-19 virus. So for the Oneida jurisdiction or the Oneida reservation, we currently have 7 positives as of this morning. 3 are in Outagamie County and 4 are in Brown County. We have no deaths reported within Oneida jurisdiction due to the COVID-19. Total positives as of this morning for Brown County. Brown County's been pretty active. For Brown County as of this morning, we have 776 positive cases with 2 deaths. Outagamie County has 46 positives with 2 deaths. And overall, the state of Wisconsin has 5,911 positive cases with a total of 272 deaths. Wisconsin's hospitalization rate as of this morning was about 1,397, which is about a 21% increase. Overall, across the United States, we are about 1 million positive cases with over 55,000 deaths for the country. Globally, that means we're about 2.9 million cases of positive COVID-19 virus and over 207,000 deaths. Within Indian country itself, within the Indian Health Service, we have a total of about 2,726 positive cases from over 19,000 people tested. For the Bemidji area, which is where we are located, which includes Minnesota, Wisconsin, and Michigan, we have 33 positive cases of COVID-19. Within Indian country and Navajo Nation being the hardest hit, Navajo Nation has 1,680 cases as of yesterday. The Albuquerque area has 249 positive cases. The Oklahoma City area has 117 positive cases, and Phoenix has 219. So basically what we're looking at and how those numbers impact us directly is that we're looking at wanting to increase our testing capacity within the Oneida Comprehensive Health Division. We're working on looking at how we can do that. We still have the difficulties in terms of obtaining appropriate testing supplies and being able to get the appropriate testing kits, but we are working on improving that testing capacity. However, statewide, there's still issues in terms of being able to get access to the testing supplies, as well as the tier levels in terms of who can and cannot be tested. You may have heard a lot over the weekend in terms of the news as far as the impact that the meat factories have had in terms of the positive cases, which is another reason why we're looking at trying to work on increasing our testing capacity. One of the biggest things I think is important for us to mention at this point is that we need to continue to ask the community for your support. We need to be able to make sure that you are maintaining a safe distance, that you are maintaining that 6-foot safe distancing from other individuals, staying at home if you possibly can, staying at home if you don't feel well. If you gotta go outside, wear a mask, like my cohorts are here. Any type of a facial covering is going to help protect yourself from others and others from you. And so really want to emphasize the fact that it's still important to make sure that you are washing hands, using soap and water, using alcohol-based disinfectants if you're not able to access soap. And one of the other things that I think is important that we want to make sure that we emphasize at this point is that as we're seeing more and more increases in terms of our ability to test individuals, we're going to see more and more positive tests. And so with that, it's important to make sure that as an individual, if you do have to go out, try to keep track in your notebook, keep track on your phone, where you go, who you talk to, who you have contact with, what time that might have occurred, so that it's critically important that if you do end up getting a positive test, that we can go back and track wherever you might have been over a 2-week period from the time when you test positive. So it's critical that you be able to share that information with us. And it's not to make sure that people can track where you are. It's basically to help us from spreading the infection any further and to be able to get that information to us. I really want to emphasize the fact that sometimes people are reluctant to share that information, but it's not that we want to know what your business is. It's because we want to make sure that you stay safe and that your family members and the community stay safe so that we can track that information. Thank you, Bobby.
You're welcome. Chairman Hill.
Good afternoon, everyone. Thank you for joining us again on this Facebook Live event. Just a little quick update, I guess, from the Oneida Business Committee. We had our meeting last week and had vigorous discussion about the government's actions in the near future, I guess, such as the semi-annual meeting, which normally happens in July. And so basically the Business Committee took action to reschedule that meeting because it falls within the health parameters that were set out from the public health officer to not hold large events essentially for the next 3 months and possibly 6 months. And so that has an effect on how we operate as a government as well. I know everybody's pretty familiar with our 10-day notice policy for getting General Tribal Council information out into the hands of our membership 10 days prior to the meeting, but that is just, I guess, the short time that it takes to actually have that information in your hand. It takes a lot longer. It takes months in advance to get that information compiled and put into reports and formatted and then sent to printing and then to the mail center and then into your hands. So not being able to meet those critical timelines is one of the factors that helped us make a decision to postpone our July GTC meeting. So these are the effects that COVID-19 is having on our community and our government, and not being able to schedule our meetings as we normally would, have large gatherings as we normally would. And so I think that's important that we all take that into account, even when it comes to our families. I think, as Debbie has shared, that it's important that we stay home, that we wash our hands regularly, that we practice social distancing, and making sure that we're keeping track of where we've been, who we've talked to, who we've met, so that the health information is able to be shared, so that people can figure out if they've been in contact with someone who has been sick. And so these are it's important information that we continue to heed those warnings and heed the safety recommendations for our community. I know it's tough. It's getting warmer out. Normally this is graduation time for high schools and colleges, and it's just tough. I know it's tough. We had several birthdays in our family in March that it's a phone call and a text saying happy birthday, and we'll do something when we can. And I think that's important that we each do our part to keep our community safe. And these all, as I said in all my messaging, I guess, that the sooner we stay home and we stay safe and we ensure that we're not spreading this disease in our community, the sooner we can get back to our family life, which includes our parents and grandparents and our cousins and nieces and nephews and our children, to be able to gather again. I think that's an important part of our community and aspect that is being heard at this point. So I just wanted to express thank you to our community, for doing what they are so far. As Debbie shared, we have 7 positive tests in our jurisdiction, and hopefully we can continue to heed the advice of the health officials and stay home and making sure we're practicing good hygiene. So again, I'd just like to thank our community and all of our employees that are still out there on the front lines, continuing to work in those critical areas that are needed to keep this community alive and thriving. So thank you.
Thank you. Kaylynn.
Good afternoon. My name is Kaylynn Gresham. I'm the Emergency Management Director for the nation. I was asked to come kind of just explain what emergency management's role in all of the whole pandemic and everything is. Initially, emergency management worked with the business committee to ask for the declaration, and going forward from that, generally you'll see emergency management take the lead on disasters or things like that, should there be like a tornado or a flood. But this part is pretty much public health led, so what emergency management is tasked with is really being a huge support role for public health as well as the rest of the nation, and working to provide resources, make connections, work with the leadership on doing different kind of tracking, making sure that our ICS structure is set up, how the command and things like that work. And just from the perspective of, like, I know there's a lot of talk about PPE and things like that. Emergency management takes the lead on finding that PPE, distributing that PPE, and making sure that all of our necessary workers have the PPE is the personal protective equipment, whether that's like the masks, which mine keeps falling down, I apologize. Face shields for some of our Indian child welfare workers, the gowns that are needed, gloves for the different departments that are in regular contact with our community members, things like that. So emergency management's main role is just to be a support to the nation and public health in the best way that they can. Developing plans going forward. There's the discussion of potentially when we have our new normal and we open things back up, looking at the plans and developing those plans going forward to keep our customers and our community and our employees safe the best way that we can.
Thank you. A couple of the questions that we received. One is about the masks, and I'm not sure if Kaylynn or Debbie wants to answer the question, but should employees wear masks at all time, even if they're not traveling from building to building?
The recommendation that's been coming out that we've had from the very beginning from public health is that wearing a mask at all times is in the best interest of everybody. You're just protecting yourself and anybody that you could potentially come in contact with.
I can just add, Bobby, that I think it's important that, the primary thing that we want to emphasize is that people need to stay home. But if you do have to go out, people have to go get groceries, people have to go in and get essentials. It is best if you do wear a mask or some type of a facial covering to protect yourself from others. If you have to go in the store, if you have to go into One Stop, anything like that, that you do have a mask on, because it does help to curb the spread.
Okay, another one of the questions that, let's see. It says modeling is very important. They can hear Kaylynn and Tehassi quite well through their masks, so that we should all be modeling. So they're telling me I need to put on my mask, and I will do that in a minute. It's a little slow today because we've got some meetings that are clashing, so it's a little difficult to make sure that I'm catching all the questions. There is another question about, our weekly question about Indian preference. And I'm not quite sure how that's framed. Hold on just a minute. They're looking for, an individual's looking for a response to their questions on Indian preference and whether or not the COVID team, or why the COVID team has no one from public safety, fire, police, health, medical, only BC members in gaming. There are representatives on the COVID health team, Dr. Veer, Debbie. We also have Michelle Myers from Public Health. We also have Eric Boulanger, Chief of Police, who sits on that. We don't have a fire department here in the Oneida, and this is all our operations, our government over our jurisdiction, so we don't have an Oneida Fire Department. We do have volunteer fire departments, but they work cooperatively with our Chief of Police, Eric Boulanger. So they've been representative. They've been represented on the COVID core decision-making team. As far as Indian preference, that question comes up every week, and every week, you know, we're in compliance with Indian preference. This was a pandemic. This was an emergency situation. We're adhering to all of the policies and all of the procedures and the laws to the best of our ability. We're not out of compliance with any laws or any policies or any provisions at this time. There's Indian preference is a very broad perspective. It isn't just something like, well, he's Indian, she's not, she's Indian, he's not. It's a matter of policy and law that's very broad. So we do have a legal counsel to assure that the laws, the actions, the resolutions, and the declarations are all in alignment with not just Indian preference, but all the laws, all of our own tribal laws, our state laws, and federal laws that we're subject to. So I hope that helps clear up the Indian preference question, as well as some of the other questions about emergency management.
Well, and Bobby, if you, I can add to that as well. If there's any questions that anybody has. Since the very beginning, Brown County and Outagamie County have been extremely cooperative with the nation, towards Brown County and Oneida and De Pere are actually running what's called an area command. So we have daily briefings, twice a day, one of them specifically for public safety, the other one is specifically for emergency management. And then the COVID core team, which I'm also a liaison to, is briefed on all of the information, anything that's changing. They're constantly briefed on what's going on as far as from the law enforcement perspective, emergency management perspective, all of those things.
Thank you, Kaylynn. Here's another question. We are seeing ever increased cases in Brown County. My question is, are we working on a plan for better and faster testing? And are we putting together a team for tracking? What kind of technology are we able to use to trace cases? Debbie, do you want to take a stab at that? And then
Sure.
Maybe Kaylynn also?
Sure. We have been working very diligently on a plan to try and enhance testing capabilities within the nation. However, unlike not just our issue, but statewide, there are difficulties in terms of obtaining adequate testing supplies and testing equipment to be able to enhance the ability to test. Over the weekend, the Department of Health Services, the Center for Disease Control, the National Guard from the state of Wisconsin were all together working with Brown County as well as our representatives from our public health, and we're working collaboratively to try and look at how they can get ahead of the testing and what needs to be done. A lot of the issues that were present in terms of the actual numbers of positive testing that were coming out of some of the factories are some of the issues that they were working on trying to address. So they are trying to get ahead of the testing. We have a call on a daily basis with the hospital systems where we talk about the access to testing supplies and looking at how we can improve that. The governor himself also included that in the Badger Bounce Back Plan and made available testing supplies to many of the tribes in the state of Wisconsin. And so we are in process right now of trying to move forward with increasing our testing capacity. So we have been doing that, and we are expecting our delivery of testing supplies to come within the next day or so. And then we will work on the process in terms of the testing capacity just within Oneida itself. We are working collaboratively with Brown County and working on trying to look at the number of positive cases that they've had. We have a normal process as part of our tracking capabilities to be able to stay in contact with individuals once a test comes back positive, and we have a team that's dedicated strictly to the tracking process in terms of within the Oneida jurisdiction, but that team is also working collaboratively with both Brown and De Pere public health departments as well as Outagamie County Public Health so that we can have that communication going back and forth.
Anything you want to add, Kaylynn?
Just I think that as far as the questions with the tracking, I know that that's a big thing for everybody. It's the best way that they can help us is, like Debbie had said, is to keep track of who you've been in contact with and where you've been, because at any time you could develop symptoms, and the more information that you can provide to our public health, the better off that our public health and community is going to be in, to look for potential other people that could have been exposed.
Is contract health still available?
Yes, purchased and referred care is still available. We do have staff, although we have a decrease in the number of staff available. They are there daily, and they are available by phone as well.
Okay. Another question we have, and it comes up every week, is when is the casino going to reopen? As soon as they can get approval of all of the policies, procedures, all the different changes that are occurring right now. The casino management has been diligently working to reopen their doors. I'm sorry, this is inhibiting me. The casino managers are working. They've put together several plans. They're assured that they're ready to open, but they still have to go through the process. There's a process to close and there's a process to open. They need to make sure that the medical team approves of their plans to make sure that all the employees and all of the customers will be safe and in a safe environment. They have some targets that they're trying to meet. They're as anxious to open as everybody else to bring some normalcy back to our community. Once the casino opens, how soon will other departments and other things open? Just as the casino has to have a plan in place, and they have to meet several requirements, and they have to go through the approval of our clinical team, our medical professionals, to make sure that all of their procedures and everything that they're operating is in compliance and in a safe way. The other programs are also currently working to open up their programs to get their plans in place. So it's a long process for all of us to make sure that when we open up, that we have all these controls in place, and that everybody understands those controls, especially our employees who are going to be opening the doors, who are going to be servicing the community. They need to know what these procedures are. They need to know what their jobs are. They need to know what the new normalcy is going to be. So that's a large job to do. People are working on it all the time. How many employees at the casino? How many employees at the casino per the compact? I think maybe you're asking how many employees are still working, and is it in accordance with the compact? I'm not sure I can answer that. I believe there's less than 100 employees. We have a lot of divisions there. There's people that are in the warehouse, wardrobe, management, audit, surveillance, security. I don't know. I believe it's less than 100. Tehassi, do you have any statistics on that, Chairman?
There's about 92% of the workforce currently is laid off. So there's about 8% of the original. So definitely less than 100. Probably more closer to the range of 80 employees in the entire gaming division left at this point.
Thank you. Here's another question I don't think we can answer, but maybe we can put some insight into. Is there any kind of time frame that anybody knows of how long this is supposed to last?
That really depends. You know, I applaud our community for everything that they've done. As far as, I mean, we look at the number of cases, positive cases that we've had in the community, and we also understand that that's because of somewhat of the lack of testing. But, you know, I know how difficult it is to stay home and how difficult it is to not see your family, but because we've done that, you know, hopefully we'll be able to go forward and get back to a new normal sooner. But there really isn't a projection. I mean, if you look over what just happened in Brown County over the weekend, you know, nobody could have predicted that that was going to happen, and that just happened out of the blue. Now we've got, you know, over 200 more positive cases in one weekend, and it's really difficult. But if people can just keep, you know, staying the status quo, staying at home, and just being around your family, washing your hands, and doing the difficult part, hopefully it will be less time than more.
If I can interject something, Bobby, I think it's important, you know, that we look at some of those areas that are starting to open up, some of those states where they are giving a little bit more flexibility in terms of opening up. But the thing that we have to keep in mind is that we're not going to set a date and open the door and everything's going to go back to normal. I think, you know, looking at people, you look at all of us sitting here with a face mask on, I think that's going to be part of the new normal, and how we conduct business and how we do things is going to be different than what it was in January or even in December of this past year in terms of how we conducted our business. So I think, you know, it's hard to put an actual date, but I think if we can continue to do what we're doing, if we can continue to stay home, as Kaylynn said, and we can continue to do the 6 foot safe distancing between each other and only go out when we absolutely have to, I think you're going to see that that process of new normal is going to happen quicker than what it would if we just opened the doors and didn't follow any safe practices. So I think following safe practice is going to be the critical key.
Okay, another comment with a question is, I get frustrated when I see posts on social media where Oneida people clearly are not following recommended social distancing. No one seems to call them out, and I don't feel comfortable doing so either. Any recommendations? Kaylynn?
That's really difficult. I mean, if you don't feel comfortable calling them out, you know, I completely understand that. The biggest thing that we can do is just, you know, be mindful, and for the people that you are comfortable saying something to, you know, just that continual, I see a lot of things on Facebook about people and the different opinions that they have, and I think one of the main things that I've seen is that, you know, we do what we do now and miss things so that when we come back together and we're allowed to have our large gatherings, no one's missing. And so, you know, just kind of from that perspective, you know, we're doing this for ourselves, but we're also doing this for everybody else in the community, because every choice that we have about when we go out, we not only impact our families, but impact those people that we come in contact with as well.
Okay, another question is, are there any other employees experiencing getting denied being able to submit unemployment claims due to having an erroneous date entered? You're going to have to call the HRD. Every employee that was laid off or on furlough was given a packet of information with about 6 or 7 different employees at HRD and phone numbers and emails. If you go on our COVID website, that list of individuals from HRD are also available on there. Okay, how are the litigation being resolved for contracts halted on work being done in the reservation, and how are these interests and fees being addressed? I'm not sure if anybody here is aware of any contracts that are being halted on anything that's being worked on here. I guess that's something we'll find out from our attorneys and see if we can get that answered. We're not aware of any contracts that have been halted, and I think worldwide everybody's pretty much in alignment with understanding this COVID-19 pandemic has taken an unprecedented impact on all businesses, all governments, all communities. And people have been very understanding. There's been a lot of laws that have changed. Congress is doing things. Our people are working with our lobbyists to understand what's happening in Washington, D.C. every day. Things change frequently. So for today, we've about expended our time frame. I just wanted to say that we do appreciate the questions that we receive. Everyone is concerned, and there are a lot of questions out there. We sincerely appreciate those who are most respectful in the dialogue with us. Throughout the Oneida Nation, we've been working very hard to address the issues of more than 200 programs, services, and businesses in our operations. When you ask when is something going to open, How are we going to move forward? When are we going to recover? There's over 200 entities that have to be considered, that have to submit the plans, that have to go over their budgets, that have to look at restructuring, that have to look at how they're going to be financing, what they're going to be doing, how to communicate. And it's a very complex and difficult job to do, but we've got some people who are working together in the spirit of cooperation to move us forward. Another thing is volunteers and donations are appreciated. We've gotten questions about how to donate any groceries. You can take them to the food pantry by Water Circle Place. Go online. The COVID also has more information how you can access the food pantry and food distribution and drop off donations, what kinds of donations that they need and when their hours of operation are. Also, we've had a lot of inquiries about face masks. People who want to donate, we're in dire need of donated material and masks. And they ask about our elders. How are we protecting our elders? You can protect your elders by taking their grocery list and doing their grocery shopping, getting their medication, keeping them from going out, keeping them home, and keeping them safe. If they absolutely have to get out, find them a face mask. Call 869-4481 and we'll do whatever we can to get that person a face mask if they have doctor's appointments or places that they have to be. If you have fabric, it needs to be 100% cotton. You can contact Susan House at SHOUSE@oneidanation.org or call and leave a message at 490-3904. In the meantime, continue practicing all the things under our Safer at Home order and keep your prayers strong. We all need them. We know sometimes you say, she's saying the same thing. They're saying, wash your hands, use your sanitizer, keep your social distance. We say it over and over and over, and we hope that at some point everybody is listening. Our next Facebook Live is scheduled for Friday, May 1st. But as we've done in the past, if something comes up in an emergency, we may preempt that. But hopefully we see you back here noon Friday, May 1st. Have a great day.